Some breaking news into CNN right now. Mexico's President Andres Manuel Lopez Obrador has just announced that he has tested positive for the coronavirus. He has consistently shunned wearing masks, even while holding events around the country during the pandemic. I'm joined now by CNN's Rafael Romo. So, Rafael, what do we know about the president's current condition?
Well, that his symptoms are mild, Pam. President Andres Manuel Lopez Obrador confirmed the news on his Twitter account in the last hour. He wrote a couple of messages, the first one to confirm the diagnosis, and the second one to say that he will keep an eye on the government's affairs from the National Palace, the presidential mansion in Mexico. The president wrote the following: "I regret to inform you that I have contracted COVID-19. The symptoms are mild, but I am already receiving medical treatment. As always, I am optimistic." And Pam, the president has a daily morning news conference that is broadcast live. He said that Interior Secretary Olga Sanchez Cordero will take over while he recovers. And President Lopez Obrador, as you mentioned before, has been dismissive of measures to prevent transmission of COVID-19. In the past, he has been seen in public many times without wearing a mask, and he travels around the country meeting with officials and people and not keeping a healthy distance sometimes. He's one of several heads of state in the region who have contracted the virus, including Jair Bolsonaro, the president of Brazil, and Honduran President Juan Orlando Hernandez. Of course, former President Donald Trump also had COVID-19. Pam?
Do you know if he's had any recent events, though, where he was around a lot of other people and they're now going to have to do the contact tracing? I remember when President Trump had COVID, that was a big issue.
Yeah, it is a very good question. And for the most part, he has not changed the way he conducts business very much since the beginning of the pandemic. He has gone to different parts of the country for promoting social projects, for meeting with officials in different states. And the reality is that there were probably multiple instances in which he could have contracted the disease. It's going to be difficult really to pinpoint exactly where it might have happened. And now the thing is that he meets daily, as you can imagine, with his aides and other officials, and it remains to be seen if any other were also infected now.
All right, Rafael Romo, thank you so much for coming on, bringing us the latest there. We appreciate it. And in the U.S., it has now passed 25 million confirmed cases of the virus, but the vaccination rate is picking up speed. The CDC says more than 21 million doses of COVID vaccine have been administered across the United States. That's up more than 1.3 million doses from the days before. CNN's Natasha Chen has the very latest from Atlanta.
The U.S. has now surpassed 25 million coronavirus cases, and the death toll continues to climb, with more than 3,000 people who have died of COVID-19 every day in the last 4 days. And the Institute for Health Metrics and Evaluation projects a total of 569,000 Americans will have died from coronavirus by May 1st. Javier Becerra, President Biden's nominee to run Health and Human Services, described it this way on Sunday.
The plane is in a nosedive, and we got to pull it up. And you're not going to do that overnight. But we're going to pull it up. We have to pull it up. Failure is not an option here.
But there has been some good news. The same model that predicted 569,000 deaths also shows nearly 43,000 people's lives may be saved in that same time frame thanks to vaccination. And the 7-day moving average of new cases in the U.S. is starting to drop after an aggressive post-holiday peak, when the positivity rate stayed low enough in Chicago for restaurants and bars to restart limited indoor dining.
When the rumors started swirling around our staff that it was going to be able to happen, there was a spark in everybody's eyes to be able to know that we're going to be able to do what we do best once again, and that's an exciting thing for us in the hospitality profession.
That same look of excitement and gratitude
Oh, they're from you? How sweet. That's so very kind.
is in the eyes of millions of people lining up to be vaccinated around the country, including now mobile and pop-up vaccination sites run by companies like Amazon. The challenge is getting more supply distributed to what's currently a patchwork of local health providers who are sometimes battling website crashes and scheduling mishaps.
No one knew what the hell they were doing. So they send everybody home.
This is happening to me, and I'm well educated. My husband's a state senator. If this is happening to me, what's happening to people who don't have what I have and don't have the access that I have.
Meanwhile, officials have their eye on coronavirus variants and how well the vaccine may hold up as the virus changes.
It means we've got to, number one, do much better genomic surveillance so we can identify variants when they arise. It means we've got to double down on public health measures like masking and avoiding indoor gatherings. The bottom line is we're in a race against these variants. The virus is going to change, and it's up to us to adapt and to make sure that we're staying ahead.
Natasha Chen, CNN, Atlanta.
And joining me now with more is Dr. Celine Gounder. She was on the Biden Transition COVID Advisory Board and is former Assistant Commissioner of Health for New York City. Thank you so much for coming on, Dr. Gounder. Good to see you. If you would tell us, what are the key issues dragging down vaccine distribution across the country? We know around 40 million vaccines have been distributed, but as of this morning, only 21 million have been administered.
Pamela, the Biden administration inherited a black box as to how many vaccine doses were where all along the pipeline. So you have some doses that are coming off the manufacturing line. You have some that are in pharmaceutical company warehouses. Some of those have been allocated or assigned to certain states but haven't been ordered yet. Some of them have been ordered. Some have made it to states. Some have made it to facilities. And when you don't know how many doses are in each step of the way that I outlined, it's very difficult then to communicate to facilities on the ground and say, okay, you can expect this number of doses next week, and then for them to be able to plan appointments. So just having transparency into all of that supply chain of vaccine is really essential to being able to make this rollout much smoother.
So how much of this, though, is a state issue? Because other people would argue, look, the federal government is already doing its job in getting these vaccines, these shots to the states, and they should be able to know what to do about it from there. What do you think about that?
The states simply don't have that kind of capacity. That's not how they're set up. You are going to need to have federal funding, federal staff, federal supplies to bolster this entire process. And the reason we have been floundering all along is because the states have not had that kind of support. States also can't go into deficit spending the way the federal government can, and this is precisely the kind of situation where we need to mortgage the house if that's what we need to do in order to get ourselves out of this situation.
So bottom line, what do you think the timeline is for getting every American vaccinated? Anyone who wants a vaccine can get one.
Look, it's going to take months before we have enough doses for everybody. You know, we heard somebody in the package earlier talk about, well, if I can't get one when I have great health care, this is not a question necessarily of, are you somebody who has money or power? There simply are not enough doses for everybody. And so we're looking at probably middle of the summer, end of the summer, before the average healthy young American has access to vaccination too.
Wow, middle summer, end of summer. I also want to ask you about schools, because there's, a lot of parents are out there right now wondering about sending their kid back to school. You have this new variant. What do you think should happen in that regard?
Yeah, so there are a couple different variants that we're worried about. There's one coming out of the UK, or originated from the UK, one in South Africa, and one in Brazil. The one in the UK is concerning because it does seem to spread much more easily from person to person. So even if it doesn't cause more severe disease, it can still cause a lot more deaths and hospitalizations if it's spreading more widely. There is, however, now some new data that shows perhaps that UK strain is also more deadly because it may cause more severe disease. So that's the UK strain. And then the other two are concerning because there is some preliminary data that perhaps this may mean that our vaccines and other treatments are not as effective against those new strains as we'd hoped. Big picture, the best way to prevent the emergence of new variants is to do all of the things we've been talking about for months. The more you let the virus spread, the more it mutates, the more variants you'll have. So we absolutely need to be doubling down on the masking, the social distancing, and accelerating vaccine rollout.
And I want to listen quickly to Surgeon General nominee Dr. Vivek Murthy, just about what he had to say about this issue.
It's going to take a lot of work, though, and on several fronts we've got to focus. Number one, getting clear guidance to schools. on what they need to do to reopen. Number two, we've got to make sure schools have the resources to be able to reopen and take these measures. I do think that we can get on a path to reopening schools more safely, but it's also going to take us getting the background number of cases down in our communities, and that's where we all come in. Achieving these goals, turning COVID around, is a goal that we have to undertake together as one nation. And if we do that, then I'm confident we can turn this pandemic around.
So you didn't give any specifics there, but what do you think about sending kids back to school, and when that is a possibility, you think, across the board?
This is going to depend on how much the virus is transmitting in a particular community. So if we value reopening schools, it means that we need to do the things to suppress virus transmission in the community. Again, masking, social distancing, and accelerating vaccine rollout. The Biden administration is also going to be supporting schools in this process, and some of that includes providing science-based guidance on what to do, how to keep everybody safe. That includes assisting with purchase and use of test kits to screen staff as well as students. And then also the FEMA Disaster Fund will be reimbursing schools for the cost of some of these materials, whether it's personal protective equipment or screening testing supplies. So there's a pretty robust package to make this a safe reopening if we also do our part.
I want to get your reaction also to some news that's breaking tonight that more than 36 Capitol Hill police officers are now testing positive for COVID in the wake of the January 6th attack on Capitol Hill. What do you think about that?
So, I think this is another tragedy resulting from the insurrection at the Capitol. I think, unfortunately, when you find yourself indoors in a crowded situation where some people may not be wearing masks, that is a recipe for transmission of coronavirus. And it's unfortunate that these Capitol police officers were put at risk not just by the actions of the insurrectionists at the Capitol, but also by the virus when in the line of duty.
All right, Dr. Celine Gander, thank you for coming on and sharing your expertise and perspective with us. And on Wednesday night, CNN brings you a new global town hall in this race to vaccinate America. Dr. Anthony Fauci and top doctors from President Biden's COVID-19 team join Anderson Cooper and Dr. Sanjay Gupta for Coronavirus Facts and Fears, live on Wednesday night at 8 p.m. Eastern.